Hi, Mr. Mancini. My name is Cameron. I'm a level 2 nursing student at Conestoga. How are you doing today? Okay, so I have two injections for you. One's a subcutaneous and one's an intramuscular. The subcutaneous is 5,000 units of heparin, and the intramuscular one is haloperidol, which is a antipsychotic, or one for your schizophrenia, sorry. And can I just confirm that you do have an allergy for codeine? Okay, so do you have any questions before I go and prepare the meds? Okay, I'm just gonna take a look for any swelling or bruising or anything like that before I go do that. No, there's no lesions or inflammation. If there was, I would pick a different site of injection. Okay, I'm gonna go and prepare the meds now. So to start off preparing, we'll do the subcutaneous first. So he has an order here for 5,000 units, and 5,000 units per 1 milliliter is the dose. So we're gonna administer 1 milliliter volume, and it's subcutaneously, so the gauge of the needle, which is the needle size, has to be about 25 to 27 for subcutaneous. And the syringe size is dependent on how much you're actually administering. So 1 milliliter, yeah, okay. So we're gonna start off just by taking this out of its package. So this is, oh, no, this is the subcutaneous needle here. .25 gauge. Okay. So I'm gonna first start off by alcohol swabbing the top because that is exposed to the air, so it's considered contaminated. So I'm gonna swab that off. And this is the heparin we're doing right now. And I'm gonna uncap this and be careful. So now it's uncapped. So because this is a closed system, we have to inject the air in order to get the liquid out. And so whatever volume you're taking out, you gotta put back in with air. So I'm gonna take 1 milliliter out here, and it goes to the top of that first ring there, like so. I'm gonna take it, oh, shaky. I'm gonna just insert the air, and I'm gonna take the vial, flip it upside down like so, and slowly draw back 1 milliliter. Getting lots of air, so I'm gonna push the air back in like that. Draw back some more. There we go. It's a bit better. If you get some air like that, just push it back in and then draw back again. So like that. So that's 1 milliliter there. There's some air bubbles. You obviously don't want to inject that. So just flick the syringe, or you can tap it on the thing, on the table. Okay, I can't get that air bubble out, so I'm just gonna see if I can inject it back out. There, that's a little better. And Okay, so now we have prepared the syringe. So best practice is to not cap it, but if you're walking through a hall or something like that, you want to make sure that it is capped so that you're not putting someone at risk for a puncture or needle poke. So what you would do is you would take the cap, you'd put it against a surface like a wall, and you would just take the needle like this and just cap it like that, and now it's safe. Okay, so I'm gonna start off, well, I just prepared the subcutaneous injection. Now I'm gonna do the intramuscular Haldol, the schizophrenia medication. So I'm gonna start off by taking the intramuscular needles. The gauges are ranging from 20 to 25. This is a 22 gauge, so that's a good size. And it all depends on the patient's size too. If they're obese, you're gonna want a smaller gauge, which means a bigger needle. And if they're really anorexic or small, then a larger gauge, no larger than 25 for intramuscular. And we're gonna start off, so this is our Haldol there. Again, swabbing the top to keep it as sterile as possible. Uncap it. Actually, first we'll go over to, so he's needs 1 milligram of Haldol, and the dose on the vial is 4 milligrams per 2 milliliters. So you take 1 milligram, multiply it by 2, divided by 4, that cancels out the milligrams, and you're left with milliliters, and you're going to administer 0.5 milliliters of Haldol. So we're going to start by uncapping the intramuscular syringe, keeping the cap because we'll need it. Draw back 0.5 milliliters of air. Now we're going to inject. Inject 0.5 milliliters. Flip it upside down. And draw back. Again, I'm getting lots of air, so I'm just gonna push it up again. Down to 0.5. Like that. Take out any air bubbles. And again, capping is the same thing. Put your cap against a hard surface. You want to avoid capping whenever possible because it's a risk for needle sticks, but if you have to, then if you're carrying it in the hall, it's not safe with the needle just exposed. So now we're going to label them because you don't want to mix them up because you are giving them 2 different types of injection sites. Intramuscular, 0.5 milliliters. I'm going to label it here with this beautifully colored label. And subcutaneous heparin, I'm going to label it as well. And we're going to go over to the patient now and inject his medication. Okay, start off, again, basic hand hygiene. Put on our gloves. Okay, Mr. Mancini, I'm going to administer both your injections. I'll start off first by your subcutaneous heparin, and I'm going to insert it at your abdomen. Before I do, I'm just going to double check the abdomen to make sure it's clear of any inflammation, cuts, or bruises, which it is, so that injection site is okay to use. Start off by alcohol swabbing the injection site, but before you do any of that, just double check his wristband. Mr. Mancini, can I see your wristband? Can you tell me your date of birth and your full name? Okay, you just want to double check that it is a correct patient to avoid any medication errors. That's separately. So now you're gonna subcutaneous at the abdomen, site of injection, alcohol swab it. You're gonna take your correct subcutaneous heparin needle, which is 1 milliliter. Gonna uncap it like that. Now using 3 fingers, you're gonna hold it like a dart. You're gonna take the abdomen, you're gonna pinch it slightly, and with the bevel up, which is just a little slit in the tip of the needle, you're gonna go at about a 45-degree angle. And slowly inject the medication. Release and take out. And right away, don't worry about capping it because it's been inside of him. Just right into the sharps container, which is extremely full and should be empty. So now we're gonna go on to the intramuscular. So, oh yeah, back with the subcutaneous, insertion sites are usually the abdomen or the back of the arm where there's lots of subcutaneous fat. So now on to intramuscular. Sites of injection are his ventrogluteal here, or his vastus lateralis, or his deltoid. So we're gonna do it on his vastus lateralis. So I'll just clean up a little bit. Okay, so I'm just gonna turn the patient on his side like this. So again, you're gonna start off alcohol swabbing the site of injection. And for this one, there's no pinching of the skin. You're just going directly in, and you're going in at about a 90-degree angle, just straight down. So again, holding it like a dart, uncap it, and go straight down like that, and slowly insert the medication. And take it out, and hold it for 30 seconds. The subcutaneous heparin, you would hold it for 3 to 5 minutes because it's an anticoagulant. Okay, it's been 30 seconds. And again, dispose of this into the sharps container, like that. And you just want to monitor his vital signs and his reaction after, if he does have a reaction to it, to the medication. It could be just a common reaction to the medication, or it could be an adverse reaction. Okay. So after you're done injecting the medication, just gonna take it out, release, and hold. Because this is subcutaneous heparin, it's an anticoagulant, so you're gonna hold for 3 to 5 minutes so that he doesn't have any bleeding. And once the bleeding is stopped, you can put a gauze and a little bandage on it to hold it secure.